Are you over 60 and are you just plain tired of your back dictating your entire life? You know that feeling all too well, don't you? That deep, grinding stiffness first thing in the morning, the nagging ache that just follows you around all day, and oh, those sudden, sharp spasms that make you afraid to even bend over? You've probably been told, hey, it's just wear and tear. It's a normal part of getting older. But what if it's not normal? What if it's something else entirely? What if those usual suspects, the aging discs, the arthritis, are only half the story? What if the real culprit behind your constant pain has been completely overlooked all of this time? I'm not talking about something that requires more pills or, the scary prospect of surgery. I'm talking about a simple, critical deficiency hiding in plain sight. Okay, let's really dive into this, because understanding this one hidden factor, well, it could be the key to changing everything for you. Now, have a look at this. This is fascinating. It's basically a medical mystery told in two columns. So we've got two patients, both 67 years old, with identical MRIs. They show the exact same lumbar degeneration. Patient number one gets the standard playbook, meds, physical therapy. And 6 months later, they're still stuck in daily pain. Their life is still limited. But then you look at patient two. They had a specific mineral deficiency identified and corrected. And the result? A 60% drop in pain with no medication. So, same age, same scan, but wildly different outcomes. What on earth was the secret?
Well, the entire difference, the secret ingredient, came down to one single missing mineral, a mineral that acts like the master switch for muscle tension in your back. You see, when you don't have enough of it, your muscles, they literally forget how to fully let go, leaving you in the state of chronic, exhausting pain.
And that mineral is magnesium. I really want you to think of it as the relaxation mineral. Here's how it works. Calcium is the signal that tells your muscles to tense up, to contract. But magnesium is the equally important signal that tells them, okay, release, relax now. Without enough magnesium, that release signal is super weak, and your back muscles get stuck in this painful, semi-contracted state that just never truly goes away. So you might be wondering, how can just one mineral have such a huge effect? Well, it's because it doesn't just do one thing. Magnesium launches this powerful three-pronged attack on the root causes of chronic back pain. Let's break down exactly how it gets the job done. First, and this is the big one, it physically relaxes the muscles. Like we just talked about, it is the off switch for muscle contraction. When you're low on it, you get that deep, relentless ache from muscles that just can't let go. And it makes you incredibly vulnerable to those sudden, awful spasms from just a simple, everyday movement. Second, it actually calms your nerves. So think of your nerve endings as having little volume knobs for pain. Magnesium physically sits in these receptors and acts as a natural gatekeeper, turning that volume way down. When you're deficient, though, that gate is wide open. The volume is cranked to the max, and even tiny signals get amplified into major pain. It's what makes your back feel so fragile and unpredictable. And third, it cuts out the inflammatory fire. A lack of magnesium allows this nasty chemical called substance P to just run rampant in your body. And this stuff is a double whammy. It amplifies pain signals, and it promotes that chronic inflammation around your joints and discs that keeps the whole pain cycle churning. Magnesium helps shut down its production. So, here's the crucial question. Why is this so incredibly common in people over 60? If magnesium is this important, how are so many of us missing out on it? Well, it turns out there's kind of a perfect storm of factors that specifically hits this age group. Just look at this number for a second. An estimated 70% of adults over 60 are walking around deficient in this critical mineral. Let that sink in. This isn't some rare condition. For this age group, it's actually the norm. The odds are pretty high that if you're watching this and you have chronic back pain, this could be directly applying to you. And this slide illustrates perfectly why. It's a triple threat, really. First, our diets can change as we get older. Second, our gut's ability to absorb minerals naturally decreases, and that's made way worse by really common medications, like those proton pump inhibitors for acid reflux. And third, other common drugs, like diuretics for blood pressure, actually force your kidneys to flush more magnesium right out of your body. Okay, now listen up, because this is probably the most important slide in this whole explainer. It's the reason this problem is missed for years, sometimes even decades. That standard blood test your doctor usually orders, it's called a serum test, it's practically useless for this. It only measures the 1% of magnesium that's floating in your blood, which your body keeps stable at all costs, often by stealing it from your cells. The test you need to ask for is the red blood cell, or RBC test. That's the one that measures the other 99% that's actually inside your cells, the magnesium that's really available to your muscles and nerves.
All right, let's move away from the science for a moment and look at a real-world story to see how this all comes together. I want to tell you about a man named Frank, because his journey is just powerful proof of everything we've been talking about. So Frank was 71 and had been suffering from terrible back pain for 6 long years. And he'd done it all. Physical therapy, cortisone shots, heavy-duty painkillers, nothing really worked. Finally, a surgeon told him his only option left was a spinal fusion. In his own words, he said, "I was at the end of my rope." Does any of that sound even a little bit familiar?
But before he agreed to the surgery, Frank's doctor ran the right test, that red blood cell test, and sure enough, it showed a severe deficiency. So they started him on a targeted magnesium protocol. And just look at this timeline. In 6 weeks, his awful nighttime spasms were dramatically better. By 12 weeks, his pain was cut in half. And at the 6-month mark, he canceled his spinal fusion surgery. Now get this, because it's the whole point. His MRI didn't change one bit. The structural problem was still there, but his pain was gone.
Okay, so this is where we turn all of this knowledge into real action. I'm going to lay out a really clear, practical plan that you can actually take to your doctor to get this conversation started. So first things first, not all magnesium is created equal. The cheap magnesium oxide that you find in most basic multivitamins is barely absorbed by your body at all. The form you want to be looking for is magnesium glycinate. It has very high bioavailability, it's gentle on your digestive system, and it's bound to an amino acid called glycine, which actually helps calm the nervous system on its own. It is the ideal form for this purpose.
So here's the game plan. Step 1, and this is non-negotiable, ask your doctor specifically for a red blood cell magnesium test. Step 2, you take about 300 to 400 milligrams of magnesium glycinate at bedtime. That's going to help your muscles relax overnight. Step 3, to really boost your levels, you can use a transdermal magnesium oil or spray right on your lower back. And step 4 is key. Always start with a lower dose and increase slowly to let your body adjust.
Now, this is a really critical safety note. Your kidneys are the organs responsible for filtering out any excess magnesium. So if you have any history of kidney disease or impaired kidney function, you absolutely must speak with your doctor before you start any kind of magnesium supplement. This is absolutely essential for your safety. So let's just quickly recap the absolute key takeaways from all this. Number 1, your chronic back pain might be more of a nutritional problem than a structural one. 2, magnesium deficiency is a primary driver of that trifecta of misery: muscle spasms, nerve pain, and inflammation. And 3, that standard blood test will almost certainly miss it, which is why you have to ask your doctor for a red blood cell magnesium test.
So before you even think about another injection or start talking about surgery, your very first step is to ask one simple, powerful question. Look your doctor in the eye and say, "Before we go any further, could we please check my red blood cell magnesium levels?" It's an inexpensive test that could finally reveal the missing piece of your pain puzzle.
You know, for all these years, that relentless ache, that stiffness, those spasms, it wasn't just random pain. It was a message. Your back was trying to tell you it was missing something absolutely vital. It wasn't just aching, it was asking for help. And now you finally know exactly how to answer.